What's going on, guys, and welcome to another episode of the LivBtr Podcast. I'm your host, Jay Ciano, founder of Sabre Advisors. On today's episode, I have an amazing guest, my friend, Dr. Tania Elliott, a dual certified internal medicine specialist as well as an allergy immunology specialist. Tania is a prominent health influencer with over 80 million views across all platforms. You're going to get a lot out of this conversation that Tania and I have, and I hope you enjoy this episode.
I just want to have peace. Pay for the bill, let them take my card, never see the receipt. Good health, we prize, but everybody around prosperity.
What's up, guys, and welcome to the LivBtr Podcast. This is your host, Jay Ciano, and this is the show for people trying to optimize every area of their life. Let's go.
I just want to have peace.
Dr. Tania Elliott, welcome to the LivBtr Podcast.
Thank you for having me.
Thank you for joining me. So I've been consuming your content, and I love all of the information that I'm getting because I love geeking out on all the things. But what I don't know is much about you. I know we have mutual friends and can't wait to learn more about you. So can you give us a little background on who you are?
Sure.
Yes.
Grew up on Long Island. We have that in common, right?
We do.
Then I went straight through college, medical school, and then thought like, okay, I'm going to open a private practice on Park Avenue, faculty at NYU, and just do the like traditional healthcare path. And then like literally within like 6 weeks, I was like, I'm not doing this anymore for a number of different reasons. And so I can just sort of share with you my philosophy, my journey, and then sort of how I ended up where I am today. So many challenges with the existing healthcare infrastructure. I don't even like to call it healthcare. It's really sick care. We like to sit back and wait for people to get sick. And then we're like, oh, we can help you with that illness. Oh, and by the way, along the way of that, we might actually give you side effects. And then we're going to treat the side effects of what we've already done to you. Very little focus on prevention. Aside from that, which we could talk about a little bit more later, I was an allergist, right? So as an allergist, it's all about what your external triggers are in your environment. And I found it incredibly inefficient to have somebody come into my office and then tell me what their house looked like, right? Like, do you have carpeting? Do you have curtains? Do you have drapes? Do you have upholstered pillows? All these things, right? And I'm like, can I just see into your house in some way? So I was like, maybe I can do a tour of somebody's home because I can more accurately diagnose what's going on, because the first line of treatment for allergies is actually avoidance of your triggers. So that was one piece of it. The other piece of it was someone would come to me and say, I had the worst allergic reaction ever. I had a rash. I had this. I had that. Doc, tell me what it was. And I'm like, what? Like, how? Like, what did it look like, right? I wanted something objective to be able to make my diagnosis off of. And by the time they were able to get in to see me 3 weeks later, hence one of the problems with like access to care or their current system, we would be based on like subjective recall of like, oh, well, I think it was bumpy and I think it lasted for a day, but maybe it lasted for 2 days or whatever. I was able to make a diagnosis though if they took a picture.
Right.
And I said, okay, great. Like, show me the picture. And then I'm like, that wasn't an allergic reaction. That was bed bugs. Sorry to tell you.
No way.
I was able to make a diagnosis though if somebody had an image or a picture or captured something. So again, I'm like this existing infrastructure that's tied to real estate and tied to like, you know, face-to-face appointments that are like so separated from when an incident occurred, like didn't work for me.
Right.
So I thought maybe I could do tours of someone's home. Maybe somebody could send a text message of their pictures of their condition to me, what have you. And I was like, I know, maybe I'll do Skype. And I'll do Skype tours of someone's home, and
what
then
year
they can
is
this is 2013.
Okay.
This is before telemedicine was cool.
Yeah, that's
okay.
why I'm
now
asking.
everyone's like, oh, telemedicine, blah blah blah. But at the time, I was like the crazy fringe doctor that was like doing it. What do you mean telemedicine? How are you going to make a diagnosis? How are you going to this and that? And it's like, well, actually, we'll very accurately be able to make diagnoses through telehealth. So this was 2013, and I, of course, like as a good daughter, I went and told my mom this idea. And she's like, but Tania, Dr. Phil stole your idea. And I'm like, what are you talking about? She's like, Dr. Phil and his son, Jay, started a company called Doctor on Demand. And they literally, like, you download this app, you write in your symptoms, you click a button, and then, like, a doctor pops up on the other side of the screen, and you're able to do a telehealth, a video visit. And I was like, oh, really?
Like the Dr. Phil.
Yeah, the Dr. Phil.
And his son who's married to Morgan Stewart?
Correct.
Got it.
Jay McGraw.
Yeah.
I don't think that's the one. I think it's a different.
Is it a different one?
Different son. But anyway.
Okay.
But Jay McGraw, who's the producers of the Doctors TV show and the Daily Mail TV and all that. And they had started this company. This was in 2013. So on my mom's recommendation, I went and checked out Doctor on Demand. And I was like, oh shit, he stole my idea. But I was like, no, I'm going to contact them. Like, I want to work for them, with them. I want to build this out. And so I literally sent like a cold call email. And I was like, I really like what you're doing. I want to be a part of it. And so I was one of the early doctors with Doctor on Demand, and like 7,000 video visits later, I became like the telehealth evangelist, the telehealth guru, training hundreds of doctors on how to do telehealth examinations and how to have good webside manner, instead of bedside manner and all that. And then I just became so fascinated with two things. One is a consumer-focused healthcare experience, and then the other is how can we leverage technology to innovate in healthcare. That started me on my journey of being more on like the business side of healthcare and thinking about new care delivery models and thinking about different ways in which we could get access to patients with accurate health information and all this. So I was medical director of Doctor on Demand, then became chief medical officer of a preventive health and wellness company, then worked for the big insurance company, CVS Aetna. Wow. And then at the height of the pandemic, people were like, oh, you're like the innovative doctor who does virtual care and telehealth and this other concept of remote monitoring. So like your wearable device, imagine if all that information was accessible to your doctor, and then your doctor could actually intervene and be like, hey, Jason, get off your butt. You've only had 3,000 steps today. What's going on? Yeah. So anyway, all this. So I got recruited over at the height of the pandemic to a company called Ascension. It's one of the largest hospital systems in the country. And I ran all of their innovative programs on virtual care and telehealth and all that. And so that's sort of been my like journey. And then I realized that like I still wasn't making enough of an impact. And that's when I turned to social media. Yeah, long story short, after talking for like 10 minutes.
Not at all.
Long story short.
I need these details.
And it was actually 10 months ago that I was like, I'm putting all my chips into social media because I think healthcare professionals need to meet people where they are. Yeah. And they're all scrolling on their phones every day. And I don't care what age you are. Everyone's on their phones looking at this.
Whether they admit it or not.
Yeah. Right. And meeting them with helpful tips, advice, ways that they can navigate and live their everyday life in a way that like an aha moment for them. And like that is the first line of treatment in my mind for healthcare delivery.
Totally.
I'll pause there.
I love that. You did say a lot, and I'm going to dissect some of it and ask more questions.
Go for it.
So, and it's funny because my thoughts are going to be a little bit at random. So you talked about how your wearable can, if it was connected to your doctor, it would be amazing. Obviously, that's where the world's going, right? I'm wearing a Whoop, and when I finished climbing the equivalent of Mount Everest 3 weeks ago, I got home and my body was just shot. And I woke up, maybe a few days later, and 2 of the 3 things in my health check on my Whoop were off. My skin temperature, my HRV was so low, things of that nature. And I expected that it would have a major impact on me, but I ended up kind of getting sick as a result of it. But why isn't that available today? Like if somebody's wearing a wearable, why can't you or somebody see that and say, hey, Jay, what's going on, instead of the 3,000 steps? Like, hey, Jay, something's up. Like maybe you have COVID. Maybe, you know what I mean?
Yep.
Yeah.
So it's a great question.
Where's this going?
So there are programs, remote patient monitoring and remote therapeutic monitoring. Those are the medical type programs that exist today, where doctors can prescribe a wearable, either a continuous wearable device, a blood pressure cuff in the home, a respiratory meter in the home, what have you, and like actually get reimbursed for the service. And they are for like specific use cases for the most part. So for example, when I was at Ascension, I started a postpartum hypertension program. So when moms deliver their babies and their blood pressure shot through the roof, the traditional standard of care is that a week later, after they get discharged from the hospital, they have to go back to their doctor for a blood pressure check. So if you think about a mom that just had a really complicated pregnancy, has got a 1-week-old, right? And then especially in disadvantaged areas where maybe they have to take public transportation and they maybe don't have anyone to watch their baby, or like, it's ludicrous. So I created a program that said, we're going to prescribe you a blood pressure cuff and a tablet. And you're going to just check your blood pressure from home once a day. And we're going to be able to monitor, track, and trend your blood pressure. And then that follow-up visit will be a telehealth visit where we just sort of check in to see how somebody is feeling. And guess what? Adherence rates went up, the compliance went up. And actually, we were able to track and trend someone's blood pressure over time versus the silly snapshot in time blood pressure that you do once in a doctor's office. So like, these programs exist, they're reimbursable programs. However, the devices, right? And this sort of goes to like, you know, the device you have is a consumer device. Mm-hmm. The device that we prescribe or use that is reimbursable and part of these remote monitoring programs have to be FDA cleared devices. So it's almost like at the institutional level is the challenge. So that's one piece of it, that it's the type of device that's used. The second piece of it is the barrier to adoption for physicians. Sure. Doctors are like, I don't want you contacting me every 5 seconds when your like consumer wearable is going off, number one. Number two, they're like, I don't need Jason's continuous data. Like, you know, like let him come see me once every 3 months, right? So there is a bit of a hesitancy on the part of clinicians to want to receive this information. Sure. And then they're like, well, I don't know what I'm going to do with it. And what does it matter? And this and the other.
Makes sense.
But it doesn't make sense, actually. Well, it makes sense that's the current state, but in my mind, it doesn't make sense for the future of healthcare delivery.
Well, yeah. I mean, right? I think that, you know, for somebody like myself who's really in touch with all of the things that I'm doing, and if I'm willing to pay a premium to have access to somebody, I'm willing to do that, right? So it makes sense that for the masses, right, like doctors as a whole would be like, why would I want Jay's information? I'm not necessarily compensated to look at that much information. It would be impossible. But for somebody that's delivering a concierge service and that's a high ticket item, why not, right? Because there's probably a limited amount of patients essentially that are paying that level of service. And in my world, it's all about, you know, monthly retainers and tiered pricing and things of that nature. And it sounds like if you're willing to pay several $1,000s a month, you know, maybe you can get that type of connectivity to your doctor. And
also, like, it's not that hard to do when you actually design a program. So let's say I don't have a program, but like, you know, I put that challenge out into the ether for people who are listening and entrepreneurs who have ideas and want to do things that like, number one, I actually think it's incredibly valuable for you to come to your doctor and say, like, here's the last 3 months of what's been going on with me, right? Mm-hmm. As a starting point for a conversation. Yeah. When you're coming in for your routine follow-up visits, for example, versus like, oh, how you doing? How have you been feeling? This or that. It's like, hey, objectively, like, here's a graph of how my sleep was over the last 3 months. Here's a graph of like, oh my gosh, my heart rate went down. I got sick. I this and that. It's like, oh, well, that was when I climbed Mount Everest or whatever. Right. It allows for a way more efficient conversation with the doctor. And like for me to have a graph of like...
Only when you need access to that information. They don't need to be looking at it in real time. Like, hey, Jay, what's up? Like, something's off. Like, that would be a little unrealistic.
It's a misconception in terms of like when, how, and why to use the data is understanding Jay's baseline and then saying what has changed over time and being able to see that in a pretty graph. Like, amazing. Yeah. So that's like one piece. The second piece is there is an aspect of like a critical alert value. I can't remember which show it was. Was it Billions or something where like somebody like, or no, Sex and the City where doesn't Mr. Big die, but everything is like, hopefully I didn't give that away. But he has like somebody is able to see and notice that because he's wearing an Oura ring or something like that, right? So there is something to be said for what to do with a critical alert, a critical value. Right. But that's like few and far between. That's the same thing as like when you go to a laboratory and like you have like your blood sugar super high. Like doctors have a process in place to get an alert when there's something that's like super out of whack. Right. So you have to put those guardrails and parameters in place. I think the future of healthcare delivery though is empowering, and I think this is like the consumer mindset. I hope I'm not geeking out too much.
No, please.
The consumer mindset or the mindset of these large companies to say like, maybe we don't even need to involve the doctor. We're going to empower Jason with this information. And maybe Jason will now have these actionable insights. Or, you know, Jason's going to kind of understand, well, of course, when I push myself too much, then I got sick. And you're going to be able
Which
to.
I do,
Right. And it's a feedback loop for you that empowers you to manage your health better.
Right.
So, like, to that extent, some people will say, it's a self-service tool and a feedback loop for the individual to empower them with more information about some objective data.
Sure.
And then let them correlate that with how they're feeling.
Yeah.
But I do think that whole space has to be more accepted by clinicians and more medicalized to some extent, so that a doctor's like, yeah, show me your wearable. I want to see it. I want to see how you've been doing,
Totally. And I spend a lot of time with doctors that are really, let's call it dealing with like the Jasons, and I'm even on the, let's call it middle tier of like the lunatics that are like, really high performing in every sense of the word. And I think it's just, it's amazing how much access to information we have. And but again, I'm not like the typical person that is going to the doctor and expecting the doctor to fix me. Like everything I do in a day is based on my overall health and how I can basically show up in my life, which is pretty tedious, right? I'm running ragged for the most part, but super mindful of that. So I want to switch gears to, I have daily non-negotiables. I'm super focused on my sleep. It's actually the opposite of how I used to live my life, like in my college years and so on and so forth. And most people, I think, have that experience. But I think I know the answers to some of these questions, but I want your perspective. And by the way, I'm going to break the fourth wall for a second, because Dr. Tania in person, it's funny because I'm talking to you as a doctor, but what you're doing online is working, right? Because it's drawing attention to, and you're creatively marketing all of these things, which is amazing. And kudos to you for that, because it is having a major impact. So I said a lot there, but what are the top things that people should be mindful of if they want to optimize their overall health and not get sick as much and be fit mentally, physically, all the things? What are the most important things?
I think like an awareness and an intentionality about everything that you do is the most important thing. And that's really like understanding like, what foods am I putting in my body and how does that make me feel? And actually making that association, as opposed to like, I'm hungry, I'm going to eat, let me move on. And then like hours later, they have a headache, their stomach's upset or whatever, and they may not associate that with the food. So really like an intentionality about what you're putting in your body.
Yep, so diet, nutrition,
and intentionality around your relationships. And that's current relationships and past relationships. And like, I do believe the body keeps the score in terms of like looking at and addressing past trauma and how you show up in life. And like, it would be silly to think that that doesn't impact our health, right? And
I think it's one of the biggest.
Absolutely.
Physically and mentally.
Right? And there's toxicity of foods we eat. There's toxicity of like things that we breathe. And there's also toxicity of relationships, past or present, right? And so an awareness of that is incredibly important. And how does that make me feel?
Like that's the first time I've ever heard anybody say that. Like, so kudos to you, because it's not the typical like, easy things that people would answer the question with. So so those
amazing. Are the important things, right? And I really think that that's the core. So it's an awareness and it's an intentionality, and like and then a little bit of like gratitude for yourself, to just be like, I don't have to be perfect at everything all the time. Like, and just
is that
like
easy for you?
For me, absolutely not.
I knew the answer. That's why I asked. Yeah, good luck.
I need to be perfect at everything all the time. I need to take my own advice too.
Yeah, of course. I mean, I could see that. That's why I asked. I'm intuitive in that regard. Where do we? I mean, obviously, sleep is very important, right? Like that's a really impactful thing when you're talking about your overall health, I think, more so than ever. And then for me, it's circadian rhythm. That's where I've noticed the biggest changes for myself. That's where I think after doing that climb, I was so off from having, being in Canada, starting things at crazy hours, climbing from 6 a.m. to 2:30 in the morning, sleeping 3 hours, doing another, I don't even know how many hours, like that type of stuff. And that's what crushed me, because I came back to my normal life and I was like fried, but physically I felt better. It actually ended up taking like this mental toll on me after. A little depressing. It was a major high when I finished, and then it was like, it was the dopamine and serotonin was gone, and I like crashed more mentally than physically. My body felt good, but yeah. So I mean, I think it's like there's so many different factors, and for me, I think circadian rhythm is something that's really, really important. Waking up at similar times, morning light, going to bed at a decent hour and getting a solid, I can't get 8 hours sleep. That's impossible. Would you agree with that? Do you pay attention in your own life to circadian rhythm? Is this something that...
Yeah, I think it's really important. And before I answer the question, just going back to like mentally, right? After you've had this whole experience and you've done something and accomplished something, and we often don't celebrate the wins for a long enough period of time. We dwell on like the things that didn't go right. But then the celebration of the wins is like, okay, great, I did it, next. But the sense of purpose, I would say, is another thing that's incredibly important as we think about our overall health. And then like, to some extent, like, hey, I just lost my sense of purpose. Like you were building up towards this purpose-driven thing and you reach the summit, and then the low from it can, to some extent, come from like, well, now what?
Yeah.
And like, now I need a new purpose and I need a new thing, And
I'll be honest. I'll be very honest. I got home and it wasn't even like I had accomplished or done anything, right? So like that was more sometimes I have to like, not celebrate because I feel like I'm, like I don't want the attention. I don't want it to be all about me, and that's interesting, right? So, so I think that's part of it too. Again, just like the relationships of your household, and not that I would like want to gloat and like sit in that for a long time because I'm busy. I got like that was great and it was a great accomplishment. It's time to move on, right? I got work to do. So it's just interesting, the dynamics of everything that we encounter and face in a day. So what are you doing now exactly?
Wait, I want to answer your circadian rhythm question, which is really important, and it's super simple to do. And this is one of those things that's like an awareness thing that people just are like, oh, I didn't realize I should do that. Like unplug any night lights, for example, right? Just sleep in pitch black and work to increase your body's natural stores of melatonin as opposed to going to reach for a sleep aid that contains melatonin, for example. So like wear an eye mask, sleep in pitch black, practice some basic sleep hygiene, and don't
make your bed right away in the morning.
And don't make your bed. But yeah, so all of those things though, I like will absolutely help. But then also I'm big on like getting to the root cause of like what the sleep issue is. Is it your mind that's racing? Did you not eat enough like protein and carbs throughout the day? And so now you're like starving yourself. So you're waking up in the middle of the night because you didn't, so like always asking the question around like, what could be the root cause of my sleep issue? Yes, absolutely. Circadian rhythm's important. And that's almost like the treatment for it. But like, let's also dig a little deeper and like have a good understanding of the root cause too.
And is there too much information, right? When like I don't pay as close attention to my Whoop as I used to, for reasons like that, right? Because I can't obsess over how much sleep I got last night or how much REM sleep it was or whatever it was, because that'll really impact my belief of how my day is going to go from an energy level, right? As opposed to like, it doesn't really matter if I got the 1.5 hours of REM versus an hour. Like it shouldn't really matter that much. Sometimes I think we're overstimulated by information.
And so, so many people say this is like, oh, I'm a little obsessed with my sleep tracker. And like everyone I talk to says this. And it'd be really interesting to do a study to look at like, what does that do to negative self-talk? Right? Like, why didn't I sleep? What happened? Now I'm going to have a bad day, this, that, and the other. So it'd be very interesting to sort of look at like cohorts to say like, I had a good day. Does that lead to positive self-talk versus negative self-talk? And what is the mental health impact of having all this data and everything? And what does it say about me as a person that I can't even get my sleep right?
Exactly.
And then it screws with your whole entire day.
And that's where, for me, I learn. I let the device teach me. Right? So I'll pay close attention to it, and then it's all about how I feel from there, right? I can do that. I can kind of shut it off at a certain point and not let it affect me. But I also like just if I want to look at the information, it's there. The recovery like feature and how much strain is very helpful to me, and it has been effective to not overtrain. that's huge, because sometimes I don't know exactly where I am. I feel like I've exhausted myself on some level. And if I look at my Whoop and I'm in the yellow or even red, I take it back a notch, because I'm also a little neurotic about like waking up early and working out, trying to get a really hard workout in every morning first thing. And that's not what you need every morning necessarily.
Right.
You agree?
Yeah, I think actually a couple of days a week strength training is good enough. Absolutely,
And
better than good enough.
What about protein?
I think protein's important. Mm-hmm. I think we underestimate protein. And I also think, especially for women, like we don't consume enough protein.
One pound for every for your ideal body weight?
You got it.
I mean, 1 gram of for every, and what
1
about
gram
creatine?
Per kilogram. Creatine.
Ah, here we go.
It's a tough one, I think appropriate things in moderation, as long as you're having like your kidney function checked, and other that you're being monitored, because all these supplements are not without potential side effects. So it's okay as long as we kind of understand that there are things that we need to monitor for.
Good answer. TRT, HRT.
Well, hormone replacement therapy for women is something that has gotten a bad rap and has this supposed association with an increased risk of cancers and what have you. And like,
has that been debunked?
No, it's bullshit.
Yeah, it's bullshit.
It's quite frankly bullshit. Yeah. It can actually decrease risk of certain cancers, and women are suffering in silence, going through a perimenopausal period and a menopausal period. Doctors don't even know how to talk to women about the experiences that they're going through. It's like, imagine your doctor being like, does it hurt when you have sex? Like, it's such a oh my gosh, I don't want to go there, have that conversation. Doctors are also not educated on hormone replacement therapy, the different types, the formulation. Is it naturally occurring? Is it synthetic? Is it a cream form? Is it a pill form? So like there needs to be education within the medical community. There needs to be an openness and no more embarrassment about having these conversations. Every single woman goes through menopause. Every single woman has atrophy and pain down there. Like, there's no reason why people should be in pain, especially when there are treatments that are available. Yeah. And they're naturally occurring. Like, you get it from yams, for God's sake. So, like, I think hormone replacement therapy for women should absolutely be more mainstream. Similarly, for men, I believe that men should have a baseline testosterone level checked probably in like their 20s. Yeah. So that you have a reference point for when you're in your 30s, maybe once every 5, 10 years, your 30s, your 40s, your 50s. And then there's a correlation versus just treating an initial number and, oh, my testosterone is low at the age of 50. Well, what was the baseline? Well, I don't know. Yeah. Well, maybe your testosterone was always low and that wasn't your problem, and you're depressed and you're anxious and you're like, that's the reason why,
Great point.
So I think that that would be my recommendation, is to sort of have younger people checking baseline levels.
What about peptides?
Man, well, I don't know. Ask Andrew Huberman, because he just did a great podcast. I'm going to defer. He just did a great podcast on it.
I'll listen to it because I am obsessed with his podcast, like most people. Yeah. So where can people find you? How can we support you? And so what exactly are you spending your time on right now, obviously, in your business and your practice? Yeah. So you can find me at Dr. Tania Elliott. So follow me, engage with me. What I'm focused on right now, I think, is really cool, right? I've grown this big following. I'm going to continue to grow following. I'm dedicated to like making content. I post every day. I want to know from you what you want to see, what you want to see more of, what's working, what's not working. Where should we go deeper? Yeah. I have a YouTube channel also where I'm just sort of choosing my highest performing posts and saying, let's go deeper on these topics. I also will look at like the most Googled terms and be like, I'm gonna go deeper on this, because clearly people are searching for information on this, right? But what I want to do is crowdsource from the community, like, what should I create? Should we create, like, let's create a business together that is addressing a need. Let's like create a product or a service or something. But like, I don't want to just do that on my own and sell it. I want to like crowdsource and create this together. Like, there's a huge funnel. There's people that are like, oh my gosh, this is helping me. How can I continue to help you? And like, how can we create a community together? Or how can I create something that could benefit your health more, So like, I'm crowdsourcing. Like, what should we build and create together? That's what I want to know. That's amazing. Dr. Tania, thank you so much for joining me. This was fun. Oh my gosh, we could go forever.
I just want to have peace. Pay for the bill, let them take my card, never see the receipt. Good health, we proud, but everybody around prosperity. I just wanna have peace.